Hello, everybody. I'm Dr. Vivek Arya. I'm an endocrinologist. Today, I'm going to discuss a case who had a poorly controlled diabetes in a lady, and she had a genital infection. So let me go through this lady. She's a 68-year-old female patient who has come to clinic after starting empagliflozin 10 milligram daily for her diabetes. Now with the empagliflozin, her blood sugar levels have improved, but she complains of vaginitis and there's a continuous itching which she's complaining and looks like a yeast infection. Now we have diagnosed that she has a vulvovaginal candidiasis. Now we have to prescribe a single dose of fluconazole 150 milligram in such kind of case. After reviewing her lab test, we have noticed that after starting empagliflozin, her HbA1c has improved slightly from 8.9% to 8.2%, but still she is not under a good control, and her eGFR is 69 ml per minute per 1.73 meter square. Now here at this point of time, I would like to discuss that SGLT2 inhibitor, they are increasingly important oral medication for type 2 diabetes, and their use has been increasing day by day in current scenario. They basically leads to glucose loss from the kidney, as well as they are very good oral agent in terms of reducing the weight as well as blood pressure. In addition to lowering of blood glucose level, there's a large scale clinical trial. They have demonstrated reduction in cardiovascular and renal outcome, improvement in high risk patient with type 2 diabetes, as well as there are various benefits in terms of heart failure in people who have diabetes or who don't have diabetes as well. SGLT2 inhibitor reduce hyperglycemia in patient with diabetes by increasing urinary excretion of glucose, and this drug-induced glycosuria leads to genital infection in certain kind of patient, and this is increases almost around 2.5 to 6-fold increase in genital infection. The development of genital mycotic infection are common with SGLT2 inhibitor, and it requires a treatment and which is probably very similar to a normal kind of a case they have been treated with mycotic infection. The other risk factor could be the female sex, diabetes, and their poor control could be the other risk factor for this mycotic infection. A combination of SGLT2 inhibitor with DPP4 inhibitor offers a suitable component and strategy to achieve a target HbA1c without increased risk of hypoglycemia and weight gain with improvement in overall lipid profile. A reduction in incidence of genital infection associated with SGLT2 inhibitor has been reported when DPP4 inhibitor have been added, perhaps because of better glycemic control and other possible mechanisms which still need to be investigated. In clinical practice, the risk of genitourinary tract infection may be a barrier for preventing patient from receiving or continuing potential life-saving therapy. So in addition to local hygiene consultation on how to prevent genitourinary tract infection, identifying a combination therapy that limits the risk of such adverse event may be an interesting strategy. The putative mechanism whereby DPP4 inhibitor may moderately reduce the SGLT2 induced genital tract infection could be because of a better glycemic control and glycosuria, which may be because of SGLT2 alone, and that could be one of the important factors. And even DPP4 inhibitor activity, which is present in the yeast cell, molds and bacteria, and again inhibiting such kind of activity can modify microorganism function. These are highly speculative and sophisticated hypotheses that needs to be tested experimentally. So with this, I summarize my case, suggesting that whenever we have a patient who have a recurrent genitourinary tract infection with SGLT2 inhibitor, a combination of DPP4 inhibitor and SGLT2 can be considered, and it could be beneficial, as well as it can take care of your genital tract infection to great extent. Thank you very much. This is Dr. Vivek Arya signing off. Thank you.